Hello everyone, welcome back to my channel. Today we are going to discuss one important entity about the spinal cord injury, specifically cord infarct or cord stroke basically. So this is a very interesting entity that actually rare, but I just wanted to show you guys one of the characteristics radiology signs for cord infarct. So this is a patient like in their 60s, came after a history of aortic dissection. Now we see the patient presented to the emergency department with paralysis of the extremities. When we did his MRI, we realized that this patient has, so this is a little bit like motiony, but if you look at this, so this is the upper thoracic cord, looks fine, but when we see the mid and lower thoracic cord and also going all the way back to the conus, we see the diffuse T2 hyperintensity throughout the cord. So the entire cord looks like expanded and there is abnormal T2 signal. And if you look at this sequence, that is a stir sequence. As we know, stir is suppressing fat and it shows abnormality better. So this is the fat in the posterior soft tissues that is suppressed, and now we are looking at the cord that we see there is diffuse T2 hyperintensity and abnormal signal about the mid-thoracic cord going all the way down to the conus medullaris. So this is study because the patient was sick, done without contrast, but if we do contrast in these patients, it's not going to enhance. As we know, if this patient had anything like myelitis or infectious inflammatory myelopathy, it would have some sort of enhancement or demyelinating process. But this entity has a cord infarct. You see just T2 abnormal signal, which looks like expansion of the cord without apparent enhancement. So if we do restricted diffusion, although this is going to be very difficult technique, you're going to see some DWI bright and ADC darkness about the cord like the brain itself. So in the brain, if you have a stroke, you're going to see DWI bright and ADC dark. So here in the area of distal cord and conus, we see some areas of basically ADC darkness like the brain. So this is another sign that this is basically cord infarct right there. And then if you look at the actual sequence, we have a characteristic L sign as you see here. So I'm just going to scroll through the cord here. You see that this is the upper thoracic cord looks normal, but when we go down in the area of anterior horn, you're going to see this abnormal L sign, T2 hyperintensity parallel to each other coming all the way down. So remember this look, this is characteristics for cord infarct. They are going to show you on core exam or in real life. When you see this, it's very characteristic for cord infarct, owl sign. So basically in this patient, we know that the like the brain, we should have some sort of vascular compromise into the cord that get into the cord infarct. And in this specific patient, we know that the mid-thoracic spine mainly getting supply from artery of Adamkowitz, which is one of the major segmental radicular arteries that is coming from the aorta, usually between the T8 and L2. And then if anything that compromises this blood vessel that gets supplied to the thoracic cord through the anterior spinal artery, we are going to have this catastrophic event and cord infarct that happens primarily involving the thoracic cord all the way going down to the conus. So anything that causes compromise of the cord supply or arterial supply through the anterior spinal artery is the most common and is usually coming from the artery of Adamkowitz and some sort of aortic pathology like aortic dissection, aneurysm, or like sometimes we have like global hypoperfusion, and that's another rare cause. But just remember that it's like in the brain we should have some sort of vascular supply compromise to have cord infarct. So the hallmark, we have non-enhancing abnormal cord signal that is expansile, has restricted diffusion. If you are able to get a good DWI ADC, and then it's going to have owl sign in the cord that is hallmark for cord infarct. So if you like this video, please don't forget to subscribe and follow me on this journey. I'm going to show you more interesting cases along the way. Thank you.